Coming as a refugee to this country, I choose to become a social worker to give back to communities and people who are coming to this country. I like working for HealthPoint because we care about our patient and we serve people all around the world. My name is Maliha. I am a social worker on the care support team at HealthPoint. As a social worker, I work with patients who have chronic health condition and coordinating care between their health team, providers at HealthPoint and also outside of HealthPoint. In addition to that, I also support our refugee clinic. I just want to find out who they are, where they're coming from, what are their needs, and also what services are available for them. I hear their story, and if I see any trauma and anything bothering them, I also refer them to the behavioral health. One of my favorite memories, I was working with a OB refugee patient who was confused between primary care and also OB care outside of HealthPoint. I took time to explain to her what are the difference between OB care outside of HealthPoint and also primary care at HealthPoint, that she take care of herself and her baby by doing a lot of system education, explaining the differences, coordinating care with her provider, and also outside of HealthPoint to making appointments that she can attend those appointments and understand her health and patient. The positive feedback that I received from patient that she was able to have a safe delivery, taking care of her baby and herself, and then after delivery she could come back to HealthPoint. Now we have mother and the child patient at HealthPoint.
My name is Irma Mendoza. I'm a social worker with the Care Support Department at HealthPoint. I became a social worker because I was inspired by many social workers that my family and I met when we first moved to Seattle from Mexico in 2000 with applying for different services, including insurance. And then later, with my father having medical conditions, we met a lot of social workers who helped us along the way, and that inspired me to become a medical social worker. As a social worker at HealthPoint, my primary project here is working with the population that HealthPoint and Valley Cities share. He's coordinating care between the two organizations for the benefit of our patients, making sure that everybody and their care teams at both facilities know exactly what's going on with the patient, taking a holistic approach to providing services for the patient. So I work with connecting patients to resources and services, but also working on helping them meet their medical and mental health goals. And aside from that, we also do have our care support offices that are now at every HealthPoint. This office is set up to support patients who don't qualify for one of our already existing care coordination programs, but do need some care coordination. This is where we help every single patient at HealthPoint have access to the resources they need, even if they don't have insurance, even if they don't qualify for one of our specific programs. For me, a mission moment that I often think about is a patient I supported when he started working with me. He presented with suicidal ideation and was homeless at the moment. He was desperately asking for inpatient drug and alcohol resources. He wanted to get into a facility and get cleaned. It was a long process, but after a month or so of coordinating care with HopeLink and other organizations to get patient to his services, patient completed 30-day inpatient treatment. He came out of the facility and on his own organized his sober living facility where he's at now. He's no longer homeless. He's attending his medical appointments monthly, which he was not before. He called me a few days ago and is now wanting to set up an appointment so he can learn all about his medications. So seeing this patient come from a place where he didn't want to live to taking charge of his health, his mental health, having a place to live and wanting to find a job has been amazing. This is for sure a mission moment for me and for the patient.
I am so grateful to work with amazing social workers at HealthPoint. For years as a provider, I struggled to really meet the needs of my most complex patients. And then we got a care support office at Midway. I finally felt like I had the team I needed to help take care of my most complex patients. From patients who were in unsafe living situations to patients I struggled to reach because they didn't have a phone or a home address, to patients who were new to this country and needed some extra support to really understand their medical conditions and then needed specialist care, to patients who were frequenting the hospitals and the ERs. I have found countless patients who work with our social workers have benefited greatly from these services. I honestly can't imagine doing my job as a doctor without them. Thank you, social workers.